Today we will talk about the confusion surrounding PCOS, that is Polycystic Ovary Syndrome. Today we will discuss this confusion. We will talk about how women of childbearing age often ask themselves the question whether they have conditions such as PCOS, which is Polycystic Ovary Syndrome, or endometriosis. In fact, PCOS or Polycystic Ovary Syndrome is a very common condition among women of childbearing age. It is often observed that there are many diseases whose symptoms or signs resemble PCOS. They resemble symptoms of PCOS. This is called overlapping of signs and symptoms, and it is often mistakenly identified as Polycystic Ovary Syndrome. For example, thyroid hormone disorders, that is, diseases caused by an imbalance of thyroid hormones, and besides that, for instance, polycystic ovary without syndrome, and apart from that, the adrenal glands, which are a type of gland, are located above the kidneys. Malfunction of these, which is called congenital adrenal hyperplasia, and many other genetic disorders. Apart from this, there are some medications that can mimic the symptoms of polycystic ovary syndrome. That's why, along with being difficult, it also becomes necessary to correctly identify or diagnose the actual disease. Let's find out what are the conditions or diseases that resemble polycystic ovary syndrome. The first confusing condition among these is polycystic ovary without the syndrome. That is, when such a patient is examined, polycystic ovaries will be visible, but the syndrome itself is not present, meaning there is no hormonal imbalance. The reason for this mistake is that during an ultrasound checkup, the ovaries appear oversized and the cysts look like a string of pearls. They appear like a string of pearls. But such patients do not have any other symptoms of this kind, which it means that if there are no symptoms, then this disease is not polycystic. These patients also do not have PCOS, meaning this patient does not have polycystic ovary syndrome. The second condition is hypothyroidism and hypothyroidism. This is one problem. Secondly, for both patients and doctors, in these diseases, the menstrual cycle, irregularity, fatigue, changes in weight, all these complaints or symptoms closely mimic those of PCOS, and with a hormonal test, the disease can be diagnosed. This is a thyroid problem. The third condition is called adrenal gland disorder. This is the third type of disease or problem. This medical condition is widely known as CAH, or more precisely, congenital adrenal hyperplasia, a significant health concern.